Welcome to the Village Talks podcast. This is a space where physiology meets lived experience, where we talk honestly about the body, the nervous system, relationships, and the real questions families are asking without fear-based narratives or one-size-fits-all answers. We're your hosts. I'm Dr. Jaimy.
And I'm Dr. Brittney. We're chiropractors, perinatal specialists, and humans who work closely with families through preconception, pregnancy, birth, postpartum, and early parenthood. Whether you're preparing for pregnancy, currently pregnant, newly postpartum, raising a little one, or supporting someone who is, you're in the right place.
Let's get into today's conversation.
Hello, everyone. Welcome to today's conversation on the Village Talks podcast. I'm excited about this one. It's a really big topic. It's basically pelvic floor myths versus reality. And I'm going to let Dr. Jaimy take this one away because this is a really fun subject for her. Also for me too, but she's more well-versed in this one. So we're going to pass it off to you.
Yeah, I think the good news is in 2026, there are a lot more people who understand the importance of the pelvic floor, the role that it plays in pregnancy, birth, and postpartum. But the reality is it's a much bigger picture, right? We have to think about, best cases, we're thinking about it beforehand, and that it is something that's going to impact you through 20s, 30s, 40s. And this isn't just a menopausal little old lady problem, right? I think that, one of the most common myths that we hear is that everybody's pelvic floor is weak. Everybody's pelvic floor needs to do Kegels or needs to be strengthened. And I would say for, if you are 80 years old, so my grandmother, for example, had 5 vaginal twilight births. So at least 4 of them were likely forceps assisted. In her 80s, 5 kids, she had some urinary incontinence that was probably related to weakness.
Same for my grandma too. She had twilight births.
So I would say like that's not the population that we're discussing today, right? Our population is otherwise healthy, 20, 30, 40 something year old women who, about half of our patients at any given time, it's their first pregnancy. And then I have other patients who have 6, 7, 8 kids, right? So even that's kind of 2 different groups. So we can kind of talk in generalizations. Obviously, there are going to be, exceptions to that. But the majority of our patients and the majority of women in this age group are not experiencing true weakness, right? They have not had repetitive traumas. They've not had, 20, 30 years of changes with birth. They haven't experienced the hormonal shift of perimenopause and menopause, which significantly impacts these tissues. So really what we see mostly is tension. And even just understanding that difference as the baseline for your pelvic floor changes everything. So when I was in school and was getting training on, women's health and the anatomy and physiology of the female pelvis, even then everything was pretty much, it's weak. And the best we can do is recommend Kegels, and that we should be recommending Kegels for every one of our pregnant patients. And so I did that for years because that's what I was taught. And then I took a training when I was pregnant with my second, and it was actually a yoga teacher, but she was talking specifically about the pelvic floor and the importance of the pelvic floor. And basically everything she said was the complete opposite of what I had been taught. And I don't know if you've had this experience, but when you're out taking a training or certification or continuing education by someone who is educated and charging you money to come and hear them speak on a topic, you would like to think they know what they're talking about. And sometimes I've been there like, oh no, I'm leaving. You don't know what you're talking about. And that wasn't the experience that I had in that training, because everything she said absolutely resonated with my own experience that I had had in my body. And it was like an immediate switch for all these patients that I'd seen where I'm like, why isn't this helping? Why aren't things getting better? I was like, oh my gosh, it was such a wildly different perspective. And immediately I was like, that is right and accurate for what I see in my practice and in our population. So then, went out to try to find additional information and training from people who had a very similar perspective. And I think that perspective comes from working hands-on or hands-in women's bodies and actually getting a true feel for it instead of just making assumptions. So I think I would say that's probably the number one myth is my pelvic floor is weak, right? And then the second one is now like, yay, the pendulum has swung. But then I also hear people are like, well, my pelvic floor has to be strong for birth. And I'm like, who told you that? Because I disagree.
Why?
Yes. There's strength and there's weakness and there's tension and there's low tone. And a healthy, balanced pelvic floor exists somewhere in between, right? Where we have good tone. The tone is absolutely necessary as baby comes through pelvic inlet and meets the pelvic floor. If there is no tone, then they're not going to flex their head. We're not going to have the correct presenting part moving into the mid pelvis. And I've had those patients, right? Where especially if we've had multiple babies, they're really far out front, or we do have really low tone or weakness in the pelvic floor. There's no yield, there's no resistance, and so they stay here. So it's like
position,
exactly. So that neck flexion is important, and that is facilitated when they meet the tone of the pelvic floor. But if we have really high tone, or we have, really too much high tone it's really, really strong. But it can't lengthen, it can't soften, it can't yield. Now your body and your baby have to push through that tension as part of the birth process. And the more tension, the longer that phase is. So,
and sometimes the harder that phase is too. And that's where I see a lot of fatigue pop up in labor. And not that fatigue is never going to happen in labor, but more so if we are kind of trying to push through that pelvic floor instead of allowing those tissues to soften and yield like they need to.
It's more work. Right? Like you're not pushing, so you're not actively and intentionally doing the work, but your body is working very hard. And I think that is, for somebody who's been through labor, they're like, oh yeah. But, for a first time parent listening to this, it's the exhausting part is not the pushing. I think there is that anticipation of like, well, I'm just going to lay or be or whatever. And then the hard work comes at pushing. It's like, oh, that's, it should be the easiest part of your labor, honestly, but it isn't always. And part of that is if you do have a really extended, phase where your baby's transitioning from inlet to mid pelvis, like that, it's exhausting. Muscles are contracting to their maximum, right? It's using so much energy and so many resources. So I think that's, it's been interesting watching. This may be one of the areas I would say of my practice where I've seen the most dramatic change in the last 20 years, right? Coming out of school, pelvic floor therapists were few and far between. And they were
like unicorns back then.
Yes. And they were working in a hospital system and they were primarily seeing little old men and little old ladies after having hysterectomies and prostate surgery. Right. So there really wasn't even a lot of training included as a part of that specialty that pertained to this population. So that has changed dramatically. And there is, after I took that training, I started asking patients about pelvic floor, and every person would look at me like, it was like, why are you asking me this? Part of it, like, why is this important? And part of it is like, you're a chiropractor. Why are you asking me this? Like, let's talk about my spine. And that has changed where now almost everybody answers the questions. They understand that it's an important part of their pregnancy as a whole. And many of them are, oh yes, I'm experiencing this, but I'm working on it with a pelvic floor therapist. I'm like, jackpot. Yes, exactly. So I do think there's a lot more awareness, but I think along with that awareness, there's a lot of misinformation. And so I do think that I would say that is probably the biggest one, is that tension is actually far, far, far more common in 20s, 30s, and 40s. It comes from so many different places, right? I think for me, it came from years and years and years of competitive athletics. nobody talks about how to breathe.
Mm-hmm.
Nobody talks about,
I could go on about that one.
right?
Yeah.
Nobody talks about your core and balance and activation. It's just like, do you crunch it, and you're young and you're healthy and there's the assumption that everything is okay.
Mm-hmm.
And maybe it is.
Yep.
And then
maybe you give yourself a diastasis like I did.
Yeah. Maybe get into a car accident when you're 16 and it creates so much torque and torsion in your body and your fascia that you end up with, things down the road. So there's all these things that come into our bodies. And I think that I'm sure you see it too. Mm-hmm. What do you think has caused this problem? Pregnancy. I'm like, nah, girl. This was there before. Yep. But these are the things that become really apparent when you see the same thing again and again, which is your pelvic floor issues didn't start in pregnancy. Mm-hmm. What was the tone, the tension, the balance in your pelvic floor that you brought into this pregnancy?
Exactly. Yep.
And we're finding more and more that women who've never had babies are experiencing urinary incontinence, stress incontinence, pain with intercourse, constipation, even though they eat really clean and they have plenty of fiber and they're well hydrated. And it's like, these are all indicators of some sort of imbalance in your pelvic floor.
Absolutely. There was a really great pelvic floor physical therapist that I watched. Gosh, this was probably in like 2021. I don't know. She did like a live on social media and I really loved her quote. And she said, sitting constantly is the new smoking for your pelvic floor. That's how detrimental it is to sit for that long without taking breaks, without just getting some, even if it's 5 to 10 minutes of movement. And I was like, oh, I never thought about that. Cause here I was freshly graduated, like a year out of school, out of our chiropractic program. And all I did was sit.
Yeah.
I mean, luckily I was the person in the back. Like I took all the standing desks cause I didn't like to sit in those chairs. But I mean, when we're in little school, grade school, into high school, into college, into our graduate programs, if we go there, like we are constantly sitting for that long. And then you go into the workforce and maybe you have a desk job and now you're just sitting all the time. And your 1 hour workout class, maybe a few times a week, isn't going to cut it.
Nope.
Yeah. And that's why I think we see so much tension now, and not weak pelvic floors, but actually too tight of a pelvic floor where Kegels aren't what we should be doing.
No. And, we are lucky to collaborate with great pelvic floor OTs and PTs here as part of our practice. But that's, when patients tell me that they've been in pelvic floor therapy and it's not working, or things are getting worse, like those are some of the immediate questions. Or, well, what do they have you doing? Like, what did they tell you is happening? And, you can absolutely have weakness in your 20s and 30s. Yeah. It's certainly not the most likely thing. And so when they're like, well, I'm doing my Kegels, and I'm like, and at this point, like I've probably already had my hands on their body and have a sense that like global weakness is probably not your issue, or what I feel externally doesn't line up with internal weakness. Right.
And I will say, just so everybody knows, we do not do internal work. We are doing all external work, but it still gives us a good idea through these questions and what we're finding in that aspect of the body of what could be happening with the pelvic floor.
Yes. And we can absolutely tell through an external assessment. Like I can't be like, oh, your left obturator is tight or has, a trigger point. No, we're not feeling that. But I can tell when there is a substantial imbalance from left to right.
Yep.
I can see it in your rotation.
Yep.
So chicken and egg, I don't know, but it's there.
Yeah.
We can tell global tension in the pelvis, global weakness. If your tailbone cannot shift out of a severely tucked position, I know that your posterior pelvic floor is short and tight, right? Yeah. So there are safe assumptions that we can glean through an external exam. Yeah. And so, I think that's an important thing for people to realize too is, in this day and age, there's so much out there, right? Google, social media, now we've got all the AI stuff. There is no substitute for a hands-on assessment to understand the baseline of your body. And not everybody that comes to us wants to do pelvic floor therapy. It may I mean, in a perfect world, you've got a handful of specialists on your birth team, but that isn't always feasible or accessible to people. If we make a referral, it's for a good reason.
Yeah.
But I think that most people don't have any sense of what's really happening. There are some self-assessments out there. There are some clues for sure where you can be like, oh, I probably have tension, or maybe I have weakness for sure. But I think if you're going to do something about it, you want to have someone give you a baseline and let you know, yes, you have tension, and relaxation and release work is going to be more beneficial versus, yes, you have weakness and strengthening and stabilizing is going to be more beneficial.
Yep. I think another myth too versus reality is what I have found is a lot of people in their pregnancy or even beforehand, they say, well, I'll go to my pelvic floor physical therapist when I get my 6-week all clear postpartum. And they think that it's really only for postpartum care because their body went through this big transition in pregnancy and labor. And yes, it did. And yes, still utilize them in postpartum. But I know you do this too, but we recommend it in pregnancy.
Absolutely.
And like I would say, I mean, when people are asking me, okay, I'm starting to plan, I want to do all this stuff, I'm like, check your pelvic floor. Go to a pelvic floor physical therapist, OT, whoever in that realm of things when it comes to pelvic floor stuff before conception. See how it's doing, that you have an idea. You don't have to do that, but I recommend it. Yeah.
Well, and I think too, yes, it is absolutely like, oh, this is an after pregnancy thing. I'm like, well, if it's a pregnancy thing, it might not need to be an after pregnancy thing. Like this is like, why are we going to wait for issues and then try to fix them after?
Yep.
Where like this is it's not even prevention of problems postpartum. It's that your pelvic floor arguably is one of the most important structures in your pregnancy and through the birth process. Yep. And so to not assess it or not address it prior to birth it's a huge missing piece of the puzzle. And you're doing yourself a disservice if you're not taking that into consideration. If you're doing all these other things, most of our clientele are doing a lot of things, right? Like they have this awareness that these things can help. They can help me feel better in my pregnancy. They can help my labor go more smoothly, whatever that looks like for them. And then hopefully you're going to set them up for a quicker, easier, more complete postpartum recovery. So I'm like, you're actively doing these things. This is a crucial part of the puzzle.
Yes.
Even if you're like, look, I don't want to do internal pelvic floor therapy. Okay, we can give you some big picture recommendations. There are people outside of that specific specialty that still have training that can be helpful to contribute to this big picture, but to not have anyone check it or assess it or take it into consideration it's like 3 steps forward and 2 steps back. Like you're missing out. You're kind of beating your head against the wall if we're not taking it into consideration at all. Go ahead. No, to say I do think that I think second trimester is a great time to have it checked, because first trimester, you're mostly just trying to chill and be low key. I mean,
sometimes survive.
Yes. And unless there's a very obvious specific pelvic floor issue, I don't know a lot of pelvic floor therapists that are like, yes, you absolutely need to come in first trimester. I think second trimester is kind of the general guideline. You get a baseline, right? Relaxin is not crazy high. Your weight hasn't increase significantly. It's just a good time to get your baseline and get some information, whether it's strengthening exercises, whether it's stretches, whatever that looks like. I think they do a great job of talking about breath and incorporating the breath and
how to breathe correctly,
how to push correctly. Really don't want somebody trying to teach you that in labor. Ideally, you've practiced that a little bit beforehand. Lots of benefits there. And then you also don't necessarily have to wait until 6 weeks postpartum.
I might not do internal Before 6
No.
weeks, yeah.
But
Usually the consensus,
the
but
breath
yeah.
work is the most important piece.
Exactly.
And
Yep.
we do that as part of our postpartum, ideally around 2 weeks. But if
Mhm.
you're not seeing us or you're not seeing someone who is trained in that,
Yep.
this is something else that they're going to introduce before that 6 weeks that is going to change the trajectory of your healing journey.
Absolutely.
Yeah.
Yeah. And just what I was going to say a little bit ago is why we care so much about this topic and all the other stuff too is because we want you to enjoy your pregnancy. We want you to have a beautiful birth as best as possible. Things happen. We understand that. But as best we can, like, we don't want you to have to fight through this in your labor. And then we also want you to have a complete recovery postpartum because of what we've seen in practice.
Yep.
And the whole point of this podcast and what we're doing and how we're structuring our practice and all that is to really support women in this journey better than they have been ever before.
Yes. Yeah. And I think in a lot of ways things are getting better, but we still have a very, very long way to go.
Yeah. We still don't do research on women because we're too complicated.
Yeah.
We're getting there, but I mean, even then it's still very like minimal in terms of what we see in terms of research.
Yep.
Mm-hmm.
Yeah. And I mean, the leaps and bounds in understanding the pelvic floor and its function and just kind of, female genitourinary anatomy and physiology in general is massive in this century.
Yeah.
And so that's why I think the perspective has changed. The recommendations have changed because we understand it better now than we did 20 years ago.
Definitely.
Yeah, I think, and when we talk about the tension and why the tension is so important is sort of understanding like, well, what exactly is the pelvic floor, right? So if you're a provider on here, you know, and I do think that there's a general sense within the majority of the population, but it's a group of muscles, layer upon layer of muscles that are literally holding your organs inside of your pelvis.
That men also have too. The number of times I have heard men ask like, oh, I have one of those too. I'm like, yes, yes, you do.
Otherwise you'd be carrying all your organs in a bag between your legs.
Out of your body.
Yeah. Things do slip into that little bag sometimes, and that's no bueno. And you know that. Let's keep them all on the inside. But yeah, it is this layer of muscles, and within the healthcare world and definitely within our birth world, we talk about it as the pelvic diaphragm a lot, right? And so most people are familiar with the respiratory diaphragm, and it's, muscles that separate your thoracic cavity from your abdominal cavity.
Chest from your abdomen.
Yes.
Yep.
But your pelvic diaphragm, your pelvic floor sits at the bottom of the abdominal cavity, and they really should move in tandem.
Yes.
For a lot of people, they don't. And it's a dysfunction. And it's a dysfunction that a large percentage of the population has.
Oh, for sure.
And so when that's not happening the way that it's supposed to, usually because of a way that we've chosen to breathe, because of something we've done, like my breathing was jacked up from years of running. And there's a great way to breathe when you run, but you really shouldn't breathe like that all the rest of the time.
Yeah, same for years of swimming here.
Yes. So any type of athletics, anybody who's worked really hard athletically and has pushed their body to like physical limits, the way you breathe when you're at peak exertion is wildly different than how you do at rest.
Definitely.
Neither one of these is functional for the opposite activity, right? As someone who played a woodwind instrument, when you play an instrument, you have to breathe a certain
what did you
way.
Play?
I played the flute.
Oh, nice.
Which doesn't require it's big inhalation, slow controlled exhalation, right? We look at, so all of the instruments that require breath have little nuances to the way that you breathe.
Totally.
There's this way to breathe to sing. There's a way to breathe to stop a panic attack, right? Like there's so many different ways to breathe, and they're all great for that specific activity.
Yeah.
And when you do that activity all the time, it becomes the only way you breathe.
Definitely.
And that's not super functional.
Yeah.
So for a lot of people, this tandem movement is altered in some way, which means we are not maintaining neutral intra-abdominal pressure through each of our breath cycles.
Yep.
So that impacts the core.
Yep.
Which part of the core, in what way,
The core is
lot
so
of variety
big too, though. I mean,
Mhm.
it's not just the front where it's our rectus abdominis that gives us a six pack, right?
Mhm.
Everyone thinks that, or like it's our 6-pack plus maybe our obliques and
Yep.
our transverse abdominis.
Yep.
Cool. But it's the entirety of that system. Front,
It's your
back, side to
diaphragm,
side.
it's your
Yep,
pelvic floor,
exactly.
and it's all the muscles in the back,
Yep.
right? It is a container.
Mhm.
It is a cylinder, right?
Yep.
Top, bottom, and all the way around.
Yeah. What do you say? So it's a closed pressure system.
It's a closed pressure
Mhm.
system,
Yep.
and so the pressure only changes as the container or the system changes shape.
Yep.
Right. So if any one part of that system isn't moving,
Mhm.
then the whole big picture is disrupted.
Yep. And then core bracing goes into everything you do
Mhm.
every day.
Yeah.
Getting in and out of your car, picking up a box, working out, doing whatever when it comes to like hiking and stuff like that. Like
Yeah.
it is impacted with every single movement that you do
Yeah.
every single day. And you breathe all the time.
Yeah. I think that's something that people don't realize is that this system is there.
Mhm.
It's functioning.
Mhm.
And then we introduce something into that closed pressure system, an embryo
Yep.
that is doubling in size and growing day over day. And so every single day, your body is trying to maintain neutral in the closed pressure system while there is something literally taking up more physical space every single day.
And pushing your organs out of the way.
Yes. So there's this constant process of accommodation in order to not have the system suffer, right?
Yeah.
The abdominal muscles are going to have to lengthen and stretch.
Yep.
The pelvic floor is under increasing pressure,
Mhm.
gravitational pressure
Mhm.
to support the increasing weight. And then the whole system is shifting
Yep.
forward.
Mhm.
So now it's trying to do it, but from a totally different angle.
Exactly.
As organs are being pressed up, now the diaphragm doesn't have as much mobility and flexibility. Like,
Decrease expansion,
all to say,
all of that.
yes,
Yeah.
like there's a lot of change that happens here, and the pelvic floor is the base of that.
Yeah.
Right. And so it is going to have to increase in strength to some degree.
Yeah.
If you came into your pregnancy with a lot of strength, great.
Mhm.
You're less likely to feel a lot of pressure
Yeah.
early in your pregnancy. But if along with that strength, you don't have the ability to soften
Mhm.
and lengthen those muscles. And if anybody on here has ever been given an exercise to stretch your pelvic floor muscles, please drop it in the comments because they don't really exist. It doesn't mean there aren't ways to lengthen them.
I do like the pelvic wands and stuff that they're recommending.
Most people are doing it internally. There are
Mhm.
absolutely positions and poses in yoga that do create length in some of those muscles,
Yep.
but there isn't one that stretches them all.
Mhm.
There are ways to release tension and to lengthen these muscles, but for the most part,
Yeah.
these are not what we're doing from day to day.
Yep.
This doesn't happen very naturally through most forms of exercise that we choose.
Mhm.
And for most of us, going back to your comment from earlier, when we're seated, part of our assessment, sit on the table, close your eyes, find pelvic neutral.
Yep.
Almost 100% of them are tilted in a posterior pelvic tilt,
Yeah.
which means your posterior pelvic floor is in a shortened position.
Mhm.
Your anterior pelvic, everything is in a shortened position in your
Yep.
pelvic floor.
Yep.
So,
Back of the pelvic floor gets tight. Top of the rib cage on the front gets tight.
Yep.
Yep.
and
Mhm.
so if we do this hour after hour, day after day, week after week, month over month, year after year, this becomes our new neutral.
Yeah.
Which brings me to kind of the next piece of like, we're chiropractors. We are
Mhm.
always trying to maintain neutral alignment, restore
Yeah.
neutral alignment.
Mhm.
Why is it even important? I think people think about the bones and the joints, and I mean, yeah, like I want my shoulders to be level, and if my hips are even, and then my pant leg doesn't drag the ground, I'm like, yeah, but also every tendon, muscle, and ligament in your body
Mhm.
is attached to these bones.
Exactly.
And so if these bones are shifted or rotated, now we've either put this muscle in a slightly shorter position or a slightly lengthened position.
Yep.
And so if we combine that with living in a posterior pelvic tilt,
Mhm.
now we have multiple layers of imbalance in these tissues.
Yep.
And so it's like, yay, thank you, relaxin'. Look, we've got everything back to neutral. Yay. And then you can come back tomorrow. You're probably not going to be there.
Yep.
So you have to look at those tissues.
And the reason why, too, with that comment you just said, right, we got you back to neutral in pregnancy. And then if you come back to us the next day or the day after, or whatever, you might not be in that neutral posture, is because these patterns have lived in your system for a very long time. The body likes familiarity. If you look at anything like Bruce Lipton, whatever, that kind of stuff when it comes to neurology, when we talk about patterning, these are patterns of motor skill and development that you started when you were probably a baby.
Yeah.
And then as you learned your motor skills and developed and learned how to crawl and walk and roll over and do all these things, you are then increasing those patterns, kind of solidifying them a little bit more. And then when you add different things that you do in your routine every single day, that's the same thing. You're just strengthening that specific pattern.
It.
Yep, exactly. All the time. And so in pregnancy, yes, with relaxin', it's nice because we don't have to work as hard to kind of unwind these patterns. At the same time, it's not uncommon for your body to go right back to it because it's familiar and it wants to stay in that familiar shape because it's safe.
Yes.
That's where it feels the safest. Doesn't mean it's the best for you.
It's what's most familiar to your nervous system.
Exactly.
That's that safety, right? Because it's not just the joint. It's not just, although there's a whole lot of nerve tissue in your joints that are telling your brain where you exist in space.
Exactly.
And so, we're looking at the joints, we're looking at the muscles, we're looking at the ligaments. When we do something again and again and again, that pattern becomes your new neutral or your new normal, right? So people sit and they're like, well, this is comfortable. And I'm like, yeah, because you're there all the time.
Yeah.
And the muscles in the back are used to being stretched and the muscles in the front are used to being short. And you're used to your head being forward. And so this can feel really unnatural and unsafe because this isn't where you exist. But this is where your tissues are in a neutral position where we have the least amount of stress on them, where it's easiest for you to activate or contract them, where we have less traction on your nerves. So that's why we are so focused on neutral, because it impacts every one of these tissues.
Exactly.
And so when we look at the pelvic floor specifically and we think about where do these muscles start, where do these muscles end, what happens in our neutral is that these are no longer neutral.
Yep.
And so we're now applying, I love people like, oh, the doctor said the baby's pressing on my nerve. No, girl, your baby is not in there going, meow, meow, meow. Like that is not how this works.
Yeah.
You have a ton of rotation in your pelvis.
Yep.
So because of that, this muscle over here is shortened and your baby is over there.
Yeah.
And it's not anything to do with your baby's, they're not doing it on purpose. Stop blaming babies for these things. But the tension or tautness of that muscle is now brings it in proximity closer to where your baby is. And also we want your baby on the other side because there's less space over there. It's all like big picture stuff.
Totally.
Yes, there may be compression of that nerve between a muscle and between your baby.
Yeah.
But it's because of your alignment. It's because of the tension in these tissues. It's because of the
your
imbalances. It's not because your baby is in there just flicking away at a nerve. Give them till they're about 3 and they'll start doing that. But yeah, I think that's kind of big picture stuff on why alignment is so important. And then also looking at movement. And, we've, of course, by nature of what we do and with the yoga studio, we have a lot of our patients that are taking yoga as well. And this is always a question for me. Do you have poses where it feels very different on one side of your body than the other, where it hurts on one side and not the other? We try to sort of, you can't hold it there or you have less balance there, all of that. Those are indicative of some of these underlying patterns and imbalances. But also if your alignment is not in neutral and your tissues are not in neutral when you're standing in what your brain and body perceive to be as neutral, all of the movement that you're doing is imbalanced. And a lot of our movements reinforce the imbalances.
Exactly.
So you're like, oh yeah, I feel like a really, really, really good stretch over here. I'm going to do this, I'm going to do this, I'm going to do this. Of course you feel a stretch because this muscle already lives here.
Yeah.
So it feels tight, but it's actually lengthened. And so we're stretching. You're adding length and can't figure out why nothing changes.
Yeah. Why it stays the same. It feels good in the moment. And then you're like, meh, it goes right back to it. That's why.
And or people come in, they're like, well, it feels really good when I stretch this side. I'm like, yeah, I'm going to need you to stop doing that. You can either do both or actually you only need to stretch the other side. And they're like, what? I'm like, I know. It's not going to feel the way you want it to feel, but it's going to yield the results we're trying to get to.
Yeah.
And I think it is is something, alignment and movement and balance and breath. Anybody who is taking the pelvic floor into consideration as a part of the work that they do is going to be talking about all those things.
Yeah, absolutely.
And big picture, it's important for everybody outside of pregnancy. We think it's also important in pregnancy. And then I think postpartum is where most people are like, oh yeah, this is where I need to get it checked.
Yeah.
I will tell patients like, absolutely. Even if you're not experiencing any specific issues, it's a good idea to see what is your postpartum baseline in your core and your pelvic floor, just to know, but also because the physical demands of caring for infants is going to increase over the next 12 months. Your level of activity is going to change. You're going to go back to work where you sit all day, or you're going to start doing exercise. Like, can your body tolerate that?
Yeah. I think it's a huge conversation too, because I've seen it in practice. I'm sure you have too, where, oh, I feel fine. I don't have any incontinence. I don't have any like constipation, bowel issues, no hemorrhoids, that kind of stuff. Like I feel fine down there. I got my 6-week all clear. And then at like 8 or 9 weeks, they try running and they're like, oh no, that did not feel right. We're like, yes, this is why it's good to just get a baseline of where you are. And that way, as you're easing back into movement and exercise, I mean, they're not going on like mile-plus runs. These are like, I'm going to walk, jog, and their pelvic floor still feels really heavy. Yeah. In that moment only. Yep. And so that's where that's one example, but this is where that increased tension, that increased load as babies get bigger and they want to be held more and all that kind of stuff that you're going to have to accommodate for. Yeah. That's why it's such a big conversation. Yeah. And I'm thankful that there is more awareness around the true issues. We're always screening for this and asking about, yes, the red flags, right? Like there's every time I change positions, I have leakage, it isn't even necessarily with stress. Yeah. There are all of those. And then there are kind of like the yellow flags of like, well, I just always feel like I have to pee. Like I'm not ever leaking. I just constantly feel like I have to pee. Yeah. Right. Or like, if I don't go within like a minute, like I'm going to leak. I'm like, okay, so you're not just leaking urine constantly, but also like this isn't really a sign that things are functioning at 100%. Right. Totally. And then there's also the time frame of like, is it normal to have some incontinence a day or two after you have a baby? Absolutely. Yes. That doesn't mean the tissues are traumatized. Yeah. Right. It doesn't mean that there's permanent damage. It doesn't mean this will be an ongoing thing, but like, this whole area has gone through a lot. Give it a little bit of grace. That's what, try to settle. Like, when we say traumatized, we mean it went through a lot. Like whether it was a really beautiful, everything you could have ever wanted birth or not, it still went through a big event. Yes, tissues have stretched to their maximum capacity. Your urethra has been very firmly compressed between your pubic bone and your baby's head. Yes. Like there has been trauma to these tissues. It is a part of this process, but it also requires healing. Yes. And so through that process of healing, oftentimes a lot of these symptoms will resolve on their own. So resolution of the symptom or the quote problem doesn't mean that everything is perfectly healthy underneath. And then there's also this time, there has to be a time frame for normal, right? Like we'll have people, they have their 6-week postpartum checkup with their provider and they're like, oh, well, that's normal. Until when? Exactly. I didn't have this before I got pregnant. This should not be your new normal. So there has to be a time frame of until when. And then I also think there's this like, oh, I had the all clear. Tell me what that involved. Yeah. Because what did they do? Yes, because for most providers, the standard assessment is not your pelvic floor. It doesn't mean there aren't providers out there that have gone out and gotten additional training and are including that as part of their postpartum 6-week all clear exam. But really the only people that are fully and adequately trained to assess the tone, tension, contractile ability of every single individual pelvic floor muscle are pelvic floor therapists. Most OBs are not widely versed on musculoskeletal system. Absolutely. They got that in med school, but then your focus shifts, right? You focus into different things. You don't want me to diagnose your really complicated sports-related shoulder injury. Did I learn to do that in school? Yes. Have I cared about that for 20 years? No. Right? Like, am I capable of it? Yeah.
but I'm going to refer you out.
Yeah.
And so I think that that's an important distinction too. And a common myth is, oh, well, I got my 6-week all clear. Like they said everything was fine. And I'm like, because it's not what they're assessing, right? And if they are, like, did they assess it with you laying down? Did they assess it with you standing up? Did they ask you to bear down? Like there are things that have to happen to understand whether or not your pelvic floor actually can withstand intense exercise.
Yeah, definitely.
And I don't think there are very many pelvic floor therapists out there that are going to see you at 6 weeks and be like, yep, no restrictions, return to run. You can go do 10 miles tomorrow. Good luck. There might be some people that are capable of that. I would argue it's probably not the healthiest thing for you to do at 6 weeks when you still have relaxant on board. But if you've had it assessed and they've said, yeah, you're all good, I trust that. And, you know, that's where we look at sort of the rehab portion. And this is where I love collaboration of, you know, if you're having extreme pain and pelvic floor pressure, often an adjustment will relieve that because we're not going in and releasing the muscle. We're releasing what all those muscles attach to.
Globally around
it. And there was a great study that came out of, I believe, Australia in 2021, 2022, sometime around there, where they were doing internal measurements of pelvic floor tone pre and post adjustment.
Oh, was that Heidi? Dr. Heidi Havoc?
Maybe.
She's great. If you want chiropractic research, look her up. She's amazing.
I'm so bad at remembering names.
Yeah.
But I remember the study.
Australia? Yeah.
I think it's Australia. And it's really
Or is it
cool.
New Zealand?
It might have been New Zealand.
One of the two. Yeah. I can't remember. I think she's Kiwi.
I know it was down south.
Yep.
It wasn't here.
Somewhere around there.
But it shows that the overall tone of the pelvic floor is reduced after specific pelvic and sacral adjusting. So when you, and actually I don't even know that it shows low tone, it shows change in tone. So if your tone is high, it releases tension and reduces tone. If the tone was low, it can actually increase or improve tone. So because we're impacting the global structure of what all these muscles attach to. So when there's a generalized feeling of pressure, that is really often relieved after an adjustment. Sometimes, so yes, we are impacting the pelvic floor, but in a larger, more global way. When we have people who need really detailed internal specific work, we're always referring out for pelvic floor therapy. So it's like, yes, our goal is the same, but the means by which we are assisting you in achieving this goal and working on your body are often vastly different. I do think that, you know, we talk about those red flags and sort of like what's normal, but there is a lot of space between, okay, this is an absolute problem, you need to see somebody ASAP, and this is normal and I just have to live with it forever. And I'm in the camp of, if you didn't have it a year ago before you got pregnant, you shouldn't have it a year after you have your baby. 6 weeks after you had your baby, maybe. Even 6 months, potentially, if we're like actively rehabbing and it's improving. But that's there's got to be a gauge, and there's got to be somebody to help you decide this is no longer an issue, right? And you can decide. I had a patient come in who, she was a couple years postpartum. She was coming in for SI joint pain. I had not seen her in her pregnancy, but she got referred by a friend. And one of the things that came out in exam is that she has to wear an adult diaper when she runs. No. She has absolutely no bladder control, but it's only when she runs, and she just wears a diaper and it's fine. And I was like, I mean, it's your, like, you do you, it's your life. If you're okay with that, that's fine. But I want you to know that this is a sign that there is some underlying dysfunction in your pelvic floor. And the reality is that this underlying dysfunction is probably why you're experiencing SI joint pain, right? We don't have stability in the core. So these areas are working harder or compensating. And so, I can adjust it a couple of times and we can get rid of this SI joint pain, but it's going to come back. 2 weeks, 2 years, 10 years? I don't know. And if this is where it is now, as these tissues continue to compensate and deteriorate, and you hit perimenopause and menopause with the hormonal issues, you're going to be in depends all the time. This is no longer just when your system's under significant stress. This is something that carries through. So it's having somebody say, this, if you're okay with it, like, it's your life. I'm not going to tell you have to go do this. But you also need to hear from somebody that this isn't normal. It doesn't have to be normal. There are people that can assist with this and get you back to some semblance of where you were before kids. Everything isn't going to be exactly the same. But it also isn't normal to pee your pants with activity. And it's not normal to have to take a whole lot of medication to have regular bowel movements. If you didn't have pain with intercourse, I mean, if you were having, I would say, like, if you were having pain with intercourse before, then that should have been dealt with, but you shouldn't be having it now. One I always bring up is like, were you having orgasms before? Because you should be having them now. And if you weren't having them before, then you definitely need pelvic floor therapy, and you should have them afterwards.
Which is such a sticky subject. People get really weird about all that kind of conversation, but it's important.
It's important. Everybody's a little less weird about a lot of things after you have a baby. You're kind of like, whatever, everybody's seen everything. I don't care. So it is easier to broach those subjects in conversation with our postpartum patients. But I'm like, if nobody else says this to you, like, I want you to hear this at least once. And I'm not the person who's going to help you with that, right? Like, pelvic floor therapist is my go-to for a lot of the sexual dysfunction, because I think a lot of people have looked at therapy and they've looked at other things. I'm like, if that worked, right? Like, if it's a mental or emotional component and you've dealt with that, awesome. But I think for a lot of people, it is a physical component, and nobody's told them that there could be a physical component. And it could be as simple as your pelvic floor is so tight, it is at its maximum contraction all the time. So how is it ever going to contract further than that? Or these muscles cannot contract for anything else. Why would they contract with sexual activity? Right? Like, So there's just a lot of things I think that get normalized postpartum. I was like, oh, well, I had a baby, so now I just deal with it. I call BS.
Same. Well,
this is G-rated. I'm not going to say it, but
doesn't have to be. But I mean, that's what we talk about. Why we are so passionate, but what we mean, what we say when we say complete postpartum recovery is not just a year to two after you've had your baby. It's for the rest of your life. We want to make sure that what we're doing right now to help your pelvic floor, to help your body recover, is carried over when you are 60 and 70 and so. Like, I don't want our clients, I don't want women to have to, when they are in their 60s and 70s, to have to go back into diapers. Like, and just be like, oop, whenever I laugh, I pee a little bit. Like, my grandma did that. And I was like, cool. My mom had hysterectomy at 40. Like, I don't want that for women in general as a collective. But as we're shifting into understanding more and actually taking the time to invest in women's healthcare and that kind of stuff, like, I want this change to happen for future. That
and I think that's where we do have people who are saying what you said earlier, like, well, I'm not having any problems now. I'm like, that's great. You've had one baby. We'll see. It's often the second or third pregnancy or after the second or third birth where we really start to see some of these issues come through, because there's also a compound effect. Right? Like, no one ever feels the same in their second pregnancy as they did in their first. And it's because no matter how much rehab you've gone through, or, you could have done chiropractic and PT and exercise and all the right things, but the tissues are not the same in the second pregnancy as they were in the first pregnancy. And the reality is your tissues they're capable of healing better in your 30s than they are in your 60s. So if you first experience incontinence in your 50s or 60s, absolutely go to pelvic floor therapy then. It's going to be beneficial. It's often a great first step before we look at surgical interventions. But it's a lot hard. I mean, it's hard to do everything in your 50s than it is in your 30s, but we don't have as much collagen. Healing it's just harder, right? Our cells, everything is just older. And so, your 30s is a great time to do this, even if you're not having major issues, to get a baseline and be like, overall, you're great. I'm glad you don't have symptoms. There's a little bit of imbalance here. There's a little bit of weakness here. Like, let me teach you how to activate your core musculature in the correct order. To stabilize your intra-abdominal pressure, right? Let's make sure that your pelvic floor and your diaphragm do move in tandem when you breathe, because you're going to do this 12 to 15 times an hour, 24 hours, 12 to 15 times a minute, 60 minutes in an hour, 24 hours a day, right? Like, that's happening. And so if it's happening in a well-coordinated way, great. If it's not, you're building a deficit that will come back to you at some point. And that's the complete recovery that we talk about, right? It is it's purposeful and functional now, but it's also preventative for other issues down the road.
Exactly.
So,
yep. Love it.
I do think that kind of covers all of the things that we wanted to touch on. I mean, we could probably dive down on any one of those topics further in depth, but I think in terms of like big picture myth versus reality and kind of having an understanding of what's normal versus what's not normal goes a really, really long way.
Yeah, absolutely.
And, not everybody has easy access. Like we live in a large urban area, right? Like we're really fortunate to have a lot of people and access to providers who are skilled and well educated and kind of up to date. I think that's another thing too, is sometimes in hearing people talk about recommendations they've gotten from a specific provider, or even a personal trainer or an exercise person. Yeah. And I'm like, so if they're still talking about Kegels as like the gold standard and the go-to, I'm like, they're targeting a different audience that doesn't apply to you, or their education, their information is really, really, really outdated.
Yeah.
And you need to be seeking information from someone else, or travel or seek out or find somebody to assess you individually so that you then know which of these people's information applies to you and is going to be beneficial to you. You've got to be able to kind of tease some of that out. And I do think there are a lot of people who are relying on online programs and social media, and some of those are absolutely phenomenal. But if you don't have an idea of what your body needs, best case is it's doing no harm, but you might actually be digging yourself a deeper hole.
Yeah, definitely.
Yeah.
I could go on and on, but maybe we'll get a guest on here.
I'm sure we could find some pelvic floor guests.
We can reach out to.
Yes. Yeah.
Awesome. All right, everyone. Well, thank you for listening to yet another episode of the Village Talks podcast. As always, if you have any comments, questions, drop them in the comments below. If you have people that you want us to interview or see on this podcast or other topics, let us know. You can always find us at Belly Bliss here in Denver if you're local. And then if you have questions about providers elsewhere, send us an email. We can maybe try to find someone for you. All right. Thanks so much. Have a great rest of your day. If you found today's episode helpful, you can subscribe, share it with a friend, or leave a review. It helps this podcast reach the families who need it most. You can find us at Belly Bliss in Denver and online for resources, workshops, and support. Until next time, take care of your body and trust its wisdom.